2008. A man in his 30s walks into a clinic in San Francisco. He's just been diagnosed with HIV. He's terrified. He thinks his life is over. His doctor says something he doesn't expect. If you start treatment today and take it consistently, you'll live a normal lifespan, and within a few months you won't be able to transmit the virus to anyone. The man doesn't believe it. How can a virus that killed millions suddenly be unable to spread? The answer would revolutionize HIV prevention. Undetectable equals untransmittable. But first, we need to understand why, after 40 years, we still don't have a vaccine. In 1984, when U.S. Secretary of Health Margaret Heckler announced the discovery of HIV, she made a bold prediction. We hope to have a vaccine ready for testing in about 2 years. That was 40 years ago. We still don't have an HIV vaccine. Why has HIV been so impossible to vaccinate against? Challenge number 1, extreme mutation rate. HIV mutates 1 million times faster than seasonal flu. A single infected person harbors countless viral variants. A vaccine that targets one variant might miss thousands of others. Imagine trying to create a vaccine against a disease that's already evolved past your vaccine before you've even administered it. Challenge number 2, it attacks the immune system itself. HIV destroys the very cells, CD4 T cells, that coordinate immune responses. It's like trying to train an army while the enemy is systematically killing your generals. Challenge number 3, no natural immunity. With measles or polio, some people recover naturally, developing immunity. With HIV, virtually no one clears the infection naturally. Without natural immunity to study, scientists have no template to replicate in a vaccine. Challenge number 4, the envelope protein. HIV's surface is covered with a protein called ENV. This is what vaccines need to target. But ENV is coated with sugar molecules that shield it from antibodies, like a knight wearing sugar armor. And it changes shape constantly. Major vaccine trials in 2003, 2007, and 2013 all failed. Some even increased infection risk. Today, researchers pursue new strategies, broadly neutralizing antibodies that can recognize multiple HIV variants, mosaic vaccines that target many strains simultaneously, and mRNA vaccines using the same technology that succeeded against COVID-19. Progress is being made, but HIV remains one of the most difficult vaccine targets in medical history. In the meantime, we've found other ways. In the early 1980s, public health officials faced an impossible question. How do you stop a disease when you don't understand how it spreads? In 1984, San Francisco closed gay bathhouses. The decision was agonizing. Was this protecting public health or discriminating against gay men? The gay community itself was split. Some saw closures as essential. Others saw them as homophobic overreach. But what definitely worked was education. Condom campaigns launched aggressive safe-sex messaging. Rubbers are real lovers. Condom use, once rarely discussed, became mainstream. Harm reduction for drug users, like needle exchange programs, proved controversial but effective. Cities with exchanges saw transmission rates drop. Widespread testing and Know Your Status campaigns encouraged everyone to get tested. Partner notification systems helped trace and stop the spread. These measures worked. New infection rates in the U.S. peaked in the mid-80s at over 130,000 annually. By the 2010s, that number had dropped to around 35,000. But the breakthrough that changed everything was U equals U. Undetectable equals untransmittable. For years, people living with HIV faced a terrifying question. Even on treatment, even feeling healthy, could they still infect someone they loved? Many relationships ended over this fear. Between 2007 and 2016, researchers conducted massive studies tracking thousands of serodiscordant couples where one partner has HIV and one doesn't. The results were stunning. Among couples where the HIV-positive partner maintained undetectable viral load, 0 transmissions, not reduced risk, 0. In 2016, the Prevention Access Campaign launched with a simple message: undetectable equals untransmittable, period. The CDC, NIH, and WHO all endorsed it. For people living with HIV, U equals U was revolutionary. They could have biological children without risk. Pregnant women with undetectable loads have less than 1% risk of transmitting to their babies. U equals U didn't just prevent transmission, it shattered stigma. If you can't transmit the virus, are you still dangerous? The answer is no. HIV became a non-communicable disease. In 2024, HIV looks radically different than it did in 1984. from fear and stigma to a manageable chronic condition. That's extraordinary progress. 29.8 million people are on antiretroviral treatment today, up from 0 in 1995. But we're not done. Geographic disparities persist. Sub-Saharan Africa still bears 70% of the global HIV burden. Access remains limited in many regions. Stigma persists and discrimination continues. Some jurisdictions still criminalize HIV transmission, even when viral load is undetectable. We lack universal access and political will. Can we end the AIDS epidemic? The United Nations has set clear goals. 95, 95, 95. If we reach these, AIDS ends as a public health threat. What's on the horizon? Ultra-long-acting therapies, injections every 6 months or implants lasting a year, making treatment as convenient as possible. Better vaccine candidates. mRNA technology offers new hope. If we can create vaccines for flu and COVID, maybe HIV is next. Scalable cures through gene therapy are also being explored. The story of HIV is a story of scientific brilliance, political failure, activist courage, and human resilience. We've gone from death sentence to U equals U. The generation being born today could be the first to grow up in a world without AIDS. It's been more than 40 years since 5 men in Los Angeles developed a mysterious pneumonia. Since then, 40 million deaths, 700,000 in the US alone. An entire generation lost. But also, breakthroughs that changed medicine, movements that reshaped society. Today, someone treated early can live just as long as anyone else. They can love without fear. They can have children. They can dream about the future. The story of HIV isn't over, but for the first time we can see the ending. Visit unbedsidemanners.com for more stories. Thank you for watching.